I just returned from Gallup, New Mexico, where I was working at the Gallup Indian Medical Center through the BWPO volunteerism program at IHS, or the Indian Health Service. So I was working in the emergency department, different shifts, seeing a variety of patients, some of them very typical for the emergency medicine field, as well as some atypical. The usual trauma related to alcohol, injuries, assaults. It's pretty striking the amount of alcohol-related injuries that I saw. And some of the atypical patients, such as we were on the lookout for Hanta pulmonary syndrome, which I definitely was not used to looking out for, as well as snake bites, and as well as scorpion bites and the plague, which are all endemic in that region. They had decent emergency department layouts, clinics, the wards, the ICUs. They really actually didn't look that different from some of the rooms that you may see here at the Brigham. But I think what was the most striking for me was when you walk in, there was definitely a palpable shortage of physicians and staff. And I think that that's one area that we can definitely help with. And luckily I had been oriented on certain taboos or cultural aspects that I needed to be cognizant of going into the clinical arena. Things like making sure that I didn't speak about death, because that has a tremendous significance in the Navajo community. Making sure that I didn't talk about conditions in the setting of this may happen to you. You know, if you don't treat your high blood pressure, you may get a heart attack, because the moment that you say that, the patients perceive that you have basically willed up upon them, and they think that that will happen to them. But overall, the patients were very warm and welcoming. I remember specifically a few patients, one that had been assaulted by 10 people. I also remember a different patient. She was very reluctant to receive morphine. Eventually then allowed me to, after building some trust with her, to let me give her some morphine and treat her pain. The Navajo are very stoic people, and they'll typically will present with significant amount of pain despite what they're telling you. They'll typically hold on to that chest pain for days to weeks, or that abdominal pain, so they sometimes come in quite ill. The Navajo population is approximately 175,000 that live in the reservation, and total about 300,000 in the U.S. About 40% of them live below the poverty level. A third of them don't have plumbing in their housing. 2/3 of them don't have any phones. So their access to care is very limited, and that proves to be tremendously challenging as you're working in the emergency department or any other clinic areas. During some of the free time that I had in Gallup, I was able to really appreciate how beautiful New Mexico is. And very nearby were some really very satisfying things that you could get involved with. There was a flea market that really put you right in touch with the Navajos, and you could see their arts and crafts, their music, you could see them dancing, a lot of different cultural experiences there, as well as for you as an individual, you could go to nearby hiking trails and really get to see the land and its beauty. New Mexico is truly a beautiful state, but it's also striking how vast and deserted some of the land is, and that leads to these, people living in these areas that are very long distance from any kind of health care. I think that was the striking, the beauty, and at the same time the socioeconomic effects that it's had on the Navajo patients. This outreach program is truly in line with the Brigham's mission, and I would urge all physicians at all levels to really consider taking time out of their busy clinical daily life and just donate a week or possibly two to go there and help clinically with any kind of educational endeavors that they could provide, as well as any other way that they could help this medical center sustain itself in the long term and provide care for this disadvantaged population.